Okay, let's unpack this. When you think of hospitals, you probably picture healing, care, and a truly sterile environment.
Mm-hmm. The picture of health, really.
Exactly. But here's where it gets surprising. The healthcare sector itself is a significant, often overlooked contributor to climate change.
A really significant one.
So our mission today is to take a deep dive into a systematic review that uncovers the substantial carbon footprint of surgical care.
That's right. Globally, healthcare accounts for, well, somewhere between 4 to 8% of national carbon emissions, depending on the country.
4 to 8%, that's not insignificant.
Not at all. And surgical departments are particularly energy and resource intensive within that. What's really interesting here, I think, is how this review uses a unique framework.
Okay.
It's called the Congruence Model, and it helps explore both the sources of these emissions and, crucially, the potential solutions.
The congruence model, that sounds
Yeah.
structured, useful. Can you tell us how it helps us understand surgical emissions maybe beyond just, listing the problems?
Yeah, absolutely. It gives us 4 critical lenses: work, people, structure, and culture.
Okay. Work, people, structure, culture.
Right. These lenses help us see not just what causes emissions, but also why they persist and how all these different elements within a hospital interact or sometimes clash.
Right, how they mesh or don't mesh. Let's start with work then, the actual tasks, the procedures. You mentioned some surprising polluters here.
Absolutely. So under work, one of the major culprits is anesthetic gases.
Gases, really?
Yes, to give you a really concrete example, just one bottle of deflurane that's a common gas using it is equivalent to driving 3,539 kilometers
Wow, in a petrol car.
in a petrol car. It's staggering. Then there's the waste from discarded, unused surgical supplies.
I can imagine that.
Over 22% of items in custom surgical packs are often thrown out before even being touched.
22%, just wasted.
Wasted. And sterilization itself generates a lot of CO2. One study found re-sterilizing just a generic hand instrument set generates over 14 kilograms of CO2.
14 kilos for one set, okay.
Yeah. And interestingly, it's not just older methods. Robotic surgery, while amazing tech,
Right, very advanced.
it can actually have a carbon footprint up to 8 times higher than conventional methods.
8 times. Why is that?
It's largely down to single-use instruments specific to the robots and also increased energy consumption.
That's a truly staggering figure for advanced tech. Really makes you think about these kind of hidden impacts, doesn't it?
It does.
So if the work itself has these costs, what about the individuals? How do the people involved contribute?
Well, under people,
Mm.
we see the direct impact of human behavior. A big factor is just lack of awareness.
People just don't know.
Often, yes. Up to 60% of surgeons in some studies underestimated healthcare's total emissions. 60%.
That's a big gap in understanding.
It is. And even when there is awareness, you have habitual behavior. It's a huge factor. Clinicians often resist changing practices.
Why is that? Is it just comfort or?
It can be comfort, but often it's also a genuine fear of compromising patient outcomes.
Mm.
Sticking to what's tried and tested, even if greener alternatives exist. It's like changing any habit, really.
Yeah, that makes sense. Hard to shift ingrained practices, especially in high-stakes environments. Okay, so beyond individual choices, the report looks at structure. That's the formal policies, systems, hospital infrastructure.
Exactly. And structure really highlights the impact of disposables, single-use items.
Ah, yes, disposables.
They account for a truly massive 86% of a conventional heart surgery's carbon footprint.
86% just from disposables.
Primarily, yes. And then you have issues with policies like recycling and waste segregation. They're often underutilized.
How underutilized.
Less than 10% of operating room plastics actually get recycled. And get this,
Yeah.
while maybe 90% of what's designated as biohazardous waste could potentially be recycled or treated differently,
90%.
it often isn't. And disposing of it as biohazardous is incredibly expensive. It accounts for 86% of the total disposal costs.
So there are structural inefficiencies there, too. What are the solutions mentioned?
Things like incentivizing reusable supplies, maybe changes in procurement, and just minimizing the amount of equipment brought into the OR to begin with, rethinking the default setup.
Right, makes sense. And the last lens was culture. The informal stuff, the shared values.
Yes, culture. This is about how the prevailing ethos, which rightly prioritizes immediate patient care above all else.
Which it has to.
Absolutely. But sometimes that focus can unintentionally overshadow environmental concerns. It's not deliberate, but it happens.
So the culture isn't necessarily anti-environment, it's just focused elsewhere.
Precisely. But the review notes that embracing principles like the 5 Rs, reduce, reuse, rethink, recycle, research, and a lean philosophy.
Lean, like in manufacturing, minimizing waste.
Exactly that. Applying that mindset to processes, maximizing value by minimizing waste, this can actually align really well with structural changes to cut emissions. Culture can support the structure.
Okay, so bringing these four elements together, work, people, structure, culture, what does it all mean? It sounds like you're saying there are often incongruences, mismatches between them.
Precisely. That's the core finding, really. You see incongruence when, say, staff want to recycle plastics, people, culture,
Right.
but the hospital lacks the right bins or collection systems, structure. That's a clash.
Okay, I see.
Or maybe a surgeon keeps using high-carbon anesthetic gases out of habit, people, even though the hospital policy encourages greener options, structure, perhaps without adequate training or support.
So the different parts aren't working together.
Exactly. These mismatches are where the real challenges, but also the opportunities, lie. Real success in decarbonizing surgery needs alignment across all four: work, people, structure, and culture. It needs a holistic shift.
This deep dive really shows the power of looking at a problem from, well, from every angle. It's clearly a complex challenge, surgery, and its footprint. But there are actionable steps, things that can be done.
Definitely.
It really makes you wonder, doesn't it?
It absolutely does. And maybe this raises a broader question for all of us. If these kinds of, small behavioral shifts, when coupled with systemic changes in something as complex as surgery and hospital policy, if that can make such a significant difference in global emissions,
Yeah.
where else in our daily lives, or maybe in other industries, might we uncover similar hidden environmental impacts and similar opportunities for meaningful change?